In most markets, price and quality are already transparent, so much so that consumers hardly notice the fact that it's necessary, because it is just there, it's evident. And it's mainly because that price and quality is, for the most part, clearly and readily available. But healthcare is different, and in fact, I would argue that healthcare, or at least our healthcare system today, could be described as being price blind and quality silent. Most patients never know the cost of their care beyond possibly their out-of-pockets through a deductible or maybe coinsurance or copays. But all of us, at one time or another, as we purchase other products, I think gasoline is a good example. I bet you every one of us, at one time or another, has driven down the block to save a penny or two on a gallon of gas, or have spent some time clipping coupons on a Sunday afternoon. But we don't think twice about price when it comes to healthcare. As consumers of healthcare, we do tend to act irrationally, especially when it is paid for by a third party, and it is largely due to the lack of price and quality information available to consumers, and the fact that they don't have, historically have not had, and it's beginning to change a little bit, a lot of their own money on the line beyond their premiums. It's not that we don't care about or what something costs or how good our doctor is or the quality of our hospital, but it's simply we've never been given the opportunity to find out. And let's face it, I do think we have a healthcare system that is price blind and quality silent. And I think patients demand, they deserve better than that. When I talk to constituents around home, this is something that is beginning to resonate a great deal with people, and it has really become more of an interest to them as health savings accounts and health reimbursement arrangements have become more prevalent. High deductible plans that are out there, the exposure to the individual, to the policyholder, is greater than it has been in the recent past. So people should have the right to request an estimate of the cost of their care, particularly in non-emergency situations, before that care is provided.
I think a lot of things that we've missed, or at least one component that we've missed in our conversation so far in regards to the testimony, is that opening up information and providing information to the consumer not only helps them on the cost side, but it also helps change their behavior. And a lot of times, instead of going to that emergency room, the consumer is actually going to get the opportunity to actually see what that potential cost is associated with going to the emergency room, i.e. helping deter them from actually utilizing that service if they have another avenue to receive care. So that's another strong component of why we support the bill, is the consumers' change in behavior of how they. I mean, that's why you have deductibles on plans today. It's not necessarily it's one component of this cost, but it's another component for that employer who's picking up that cost to help cost share or allow that individual to see exactly how much each one of the services that they're utilizing costs. And so there's two components to that. It's not necessarily always on cost. There is an education process associated with it. So with that,
we're just one of those people that are the purchasers of the healthcare services provided, and it's a big issue for us in our industry, not only from the standpoint of trying to provide quality care to our employees, but also it's a competitive issue. We compete on a global basis, and it is very competitive for us against some of the foreign makers that you hear about who do well in our marketplace. They don't have to provide health care the same as we do. They do here in the United States, but outside the United States they have more nationalized health care. It comes down to us to being about a $1,200 per vehicle issue. We spend about $1,200 per vehicle. Some of our other domestics actually are more than that. For some of the foreigns, Toyota or Honda, they're down at $300 or $400 a vehicle. So it's a very competitive issue for us. We believe that what we need is a more efficient model. And we believe a more efficient model begins with trying to make it more of a competitive model, and a competitive model always includes knowing what your cost and quality data is so that you can have informed purchasers. So we believe that Representative Irvin's bill does a lot to go in the right direction to try to make it an efficient model.
And we decided that we had too many concerns to qualify as for informational purposes only. So we're going to rise in opposition, but we do so reluctantly because we strongly embrace the concepts that Representative Irvin is in pursuit of, even if we have some problems. And at the outset, I'd like to say that the sponsor has been very, very open and receptive and cooperating with us as we've worked through this. We are strongly in favor of sharing as much information as possible with the patients, and we think this bill is an admirable attempt to foster a more open marketplace. But we still have some concerns. Most of them are practical and mechanical and not philosophical.